Hello, welcome to Brave Talk. I am Dr. Giglio, clinical psychologist.
And I'm Daisy Geddes, assistant psychologist. And we are so excited to be with you again today. We have lots of exciting topics to talk about. But before we dive right in, Melissa, how's your week been so far?
It's been a very busy week personally with the SM kiddos. We've been really trying to think about how we can extend the ones we've been working with and push them a little further. So I feel like the creative juices are flowing a bit in terms of how we bring in what's happening with the school
Yeah.
or seasons and how we kind of push them in groups and individually where they need to be pushed. So it's been a good week that way. It was funny today. We only had one kid in one of our groups, and she was like, "Where is everybody?" Because some people were traveling, so she's like, "Why are there so many people with me?" And I was like, "This is a great chance for us to all practice." And so we had a lot of fun in helping her generalize speaking and being led by different adults in the group who were there. Because when we do groups, we always have one-to-one. So it was good to see, and it was good to see the behavioral difference from me transferring to another counselor, and being able to coach the counselors a little more too, but also for her to have that success with multiple adults who maybe aren't skilled to the same level, and that's okay. Like, I think that's the benefit of these groups is we're mixing and matching a lot. Yeah, so I'd say that was my big success high for today.
It's kind of fun as well just to see how they'll do when you do get that kind of surprise situation that they're not expecting and tolerating that uncertainty of like, I'm the only one here, like the pressure's all on me now.
Yeah, and, the mom coming in and just saying, "Well, last Halloween, we had a really hard time wondering how this one's gonna go," and just knowing how we prepared them last week, and we've been talking about it, and just how much further they've come in treatment at this point. Really, we're
Yeah.
fine-tuning a lot of stuff at this point just to help get over some of that resistance that still pops up from time to time, just to help her be more open. But also, how great is it to have a really positive Halloween where you're able to say, trick or treat loudly and thank you and this is my costume, and it's just really nice to see that growth from where we were when we started last year.
On that note as well, you have to fill us in. How was camp?
Camp
This weekend.
that did, yes, good reminder. It was fantastic. So we've been running camps a bit differently over the decade plus now that we've been doing it. The reason why is it's evolved. We sometimes have a range of kids. We have a small cohort of older kids and then a cohort of younger kids. It's all always based around whatever holiday's coming up, but the activities are really different based on the age range. And then we did it in a different location this time, which was fantastic, better than we imagined, because it's this amazing kid zone kind of party place. And what was so fun about it is we had our normal kind of morning routine kind of things that we go through, which of course, that's kind of like the analog classroom, giving out the daily duties and morning meeting and
Mhm.
whatever, all the stuff. That's really great for them. And they always come in and like they need a little bit of warm up always, even if they've been with us for a while, which is really, good to see how much faster that happens. But there was this amazing play space there that if we would have taken them there right away, I don't think we would have had the amount of fun that they had by taking them there at the end of the day with all that
Mhm.
adequate warm up. It was so loud and so playful and so adventurous. I can't wait to post some videos of the day because it was very much like a kid's ninja space almost, like with some of the activities.
Things to balance on,
Oh my
things to
God, things
climb,
that are
things to swing
twisting that you're
on.
going on and having to like go across it and, lots of foam things. It was phenomenal. And what's great about having one-to-one with the counselors and having a range of counselors from, older teenager to college student to graduate student, to professionals, there's this a layer of just fun that they were even having with their kids, and the kids were playing and, it's almost like a balance beam, but it's almost like a log, like a foam log, like that kind of
Mhm.
dance that they're doing against each other. It was better than I could have ever imagined, and it was hard to get them out of there, and they had a good 20 minutes at the end, but that is really what the aim is of these days, is to get the kids in that comfort zone where they are just being kids and they're not, holding back. They're not, resisting running in there. They're waving at their parents when their parents showed up from a distance, but not running out to see them. It was just the best ending to the day. The counselors were all giggling and having fun and doing some of the physical challenges too. I even got in there, which was hilarious, me and against the 20-year-olds. It was just such a great day. They're all in costume. We practiced so many great things. And then for the older kids, they worked on some of like a small research project and then presented, which was also great too. So it was a very successful day. Definitely like something that needs to continue around those holidays. I think it's really important for the practice, but the play space is just this added variable that really needs to be there. Because even if we tried to set up activities, I couldn't develop it the way this was. Like this, it was, I can't wait to share some videos from it, because the fun that they had and the different levels of challenge throughout it, that every age from 12 to, 4 were having a blast. So it's
Which is
super fun.
amazing to be able to span that age range. And even just like reflecting on previous camps that we've done, like the most magical moments looking back for me when we've been out of the clinic and we've been doing water fights, or we've been at the beach and they've been running and splashing in the ocean. It's like that freeness, that where the play kind of takes over and they're having
Yeah.
so much fun. And it's so awesome that you guys found a space to do that in this time.
I just think with our multi-day camps, we've always been mindful about when we do the excursions, for the reason that the first day is always kind of a warm-up day. The booster sessions are a little bit different, but we found so much success with those excursion days because it's really challenging in so many different levels. It's taking it outside the office or outside a classroom. It's taking it into the regular environment. There's this level of playfulness and getting dirty and being silly, and that our kids, we know some of them are really restricted from doing in school on the playground, or even when they're out with their family. So to be able to see that and make it so fun, and that's the purpose of the day, while still building their brain muscles, it's exhausting for us, but the most rewarding
It
for
just
them.
has such a good outcome. And at the end of the day, when you're seeing them be that free, as you said, you're like, oh, I may be tired, but this has been a wonderful day at the
The
office.
best day. And as dirty as we are, as sweaty as we are, like, I just love that we're just giving it our all too, and fully immersed playing, up to our up to the ocean, up to our knees in the ocean. You know,
But there's also the joy about having the younger counselors as well. They have that energy, that playfulness that really the kids kind of latch onto as well. And it just makes it such a fun time.
Yes, and I have to say, I think having a mix of male and female counselors is always also nice, just to add a different layer there, of fun. There's just different kinds of play that sometimes comes out of the male counselors and the female, and it's just nice to mix it up for generalization purposes for all of the kids. So
Yeah. Whenever we get a male counselor, we're like, yes.
yes, always, always few and far between, but we love having them. Uh, and they're usually, you have to like kids to obviously be doing what we do. So
Yes. Okay. We're going to get started with some questions that we've had come in, which I think are just going to be helpful for everyone listening, because this first one is kind of about rewards and how we use rewards and pairing them with praise. So this person says, I have a 5-year-old daughter with SM, and they're asking if we would recommend rewarding a child every time she says something. And she uses the example of a Starbucks. When she says, can I have a Starbucks? The child gets the Starbucks each time she experiences success. And the parent is asking, is that the good thing to do?
This is such a great question. I feel like we always get this early on in the process. And, I think giving rewards, especially extrinsic rewards, initially is a great way to get started with making progress. I think it's to pair the challenge with something really positive to make it worthwhile to be able to push themselves. Paired, of
Yeah.
course, with the verbal praise, the specific praise, of course, them being prepared. But, for us, we really do fade those rewards and the frequency of them as time goes on. And it's less about the reward and more about the pride that they feel from being successful and from being able to complete those tasks. Even what we outlined in the journal, it's really stepwise for how we look at building those brain muscles and those challenges. And, initially it is very little reward driven. Maybe ultimately they'll get a big reward over time, but that fades so fast. Sometimes it just becomes a bit of a habit. Again, the rewards aren't anything big. It's more of just an acknowledgement of the work and the fun for the day, where it just makes it just a little more positive. But they're excited to do it. I think it helps reduce the resistance to doing things because it almost makes it just a little more worthwhile. I actually love the rewards that seem natural, kind of a natural positive consequence of what they've done. So, you do the exposure and you order the baby chino or the cookie or the ice cream, and then you get to eat said ice cream.
Yeah.
Those I think are great. Or, we go to 7-Eleven and they get the reward right away. It's always fun when the parents are like, oh, we'll save this for later. I'm like, we just bought this now. They should get a little bit right now. Just because we're trying to help, really pair the two, the behavior and what the consequence is, which is the positive reinforcement, right? That's the result of what they're doing. So I think it's
I just
great
want
initially.
to show this example that we have in our journal now. And this is kind of an example of practicing using your brain voice and then practicing ordering a burger. So like you were saying, the natural positive result of going and ordering a
Yep.
burger or some French fries or whatever it might be. Sometimes we take
Milkshake.
kids to McDonald's, and then getting that reward straight away post doing the exposure. So that's just an example. In here, we've got other ones, like, as you mentioned, like going to Starbucks to order a baby chino or a lemonade or a slice of chocolate cake, whatever it might be, then being the natural consequence
Yeah.
of the exposure.
And I think the way we prepared the kids, the way we laid out what we did in the journal too, is really helping them to know what's expected, know what they're required to do, have the opportunity to practice in a very specific and intentional way. We often add in some added ones on the side of like, oh, what happens if they do this, or what happens if they do this, just so they're a bit more prepared. And um, but it's really helpful for them. And that means the child's done it so many times before they actually have to do it that you've reduced the likelihood of them getting stuck because it's been so rehearsed. And I think that's the biggest thing. And then just having that reward afterwards is great. And it helps you always make sure you're acknowledging what they've just done.
Mhm.
Whereas for another kid, if you say, oh, order yourself an ice cream, they're like, no problem. I can do it by myself. For these kids, this is a bigger challenge for them. So I do think it should be celebrated initially until it doesn't have to be celebrated. It's no big deal. And part of those exposures is that we try to fade ourselves kind of out of the prompting portion of
Mhm.
it. So we're trying to reduce that we're line feeding to them, that we're helping them say it, we're repeating what they're saying. We try to have them really be doing it more independently while we're distancing ourselves and able to hear them. I think that's a great natural progression for what our goal is until we can sit down and say, oh, we need to get some more napkins. Please go ask the person at the counter, and they are able to go up and ask for napkins.
I think also to bring it back to the question a bit, we get this from parents often at the beginning of treatment as well, don't we? When we're kind of, it feels so hard and we're kind of willing to, what's going to sweeten the pot for you? Is it going to be some Maltesers? Is it going to be some Skittles? What can we get that's not going to make you feel like this is too hard? And the parents are like, are we going to have to give them Maltesers and Skittles every time they say something? And this just made me think of this. And again, it's like that until it feels not so tricky. And then gradually these things get pared back until they don't need them anymore. But initially, we want to be making it feel worthwhile for them.
Yeah. And, most kids, if it's a potent enough reinforcer, will have a positive response. But there are kids that the reinforcement isn't positive enough. And that's where you really have to think about what is going to help them feel comfortable, build that bravery, and be something that feels like they're able to do it. So is it, quality time? Is it watching a movie? Is it something extra, like maybe some, iPad time, worst case, or whatever it is, figuring out what's potent to them. And I think that's individualized as well. But again, these things fade as they get easier. You don't need them as often or as consistently as they're more successful. And even when the challenges are getting harder, they're able to do it because they've had such positive experiences.
I mean, I've known you to buy Paw Patrol toys and Pokemon cards and
Whatever it takes.
whatever it takes.
Move the needle, move the needle. Yes, and that's always the goal, and I think that's something I'm just mindful of where every kid is at and how we're going to help them all get to the point where they really don't need that support in the same way. And they can handle any sudden change of plan or kind of unexpected thing that happens. That's, really when we know the kids are in a good space, when they kind of just roll with it. They're like, oh, okay, this is different.
Yeah.
No big deal.
Also, pairing the reward with the verbal praise
Very
as
important.
well. Why don't you talk a little bit about
So we are really, I think, consistent with either giving a very specific praise for how they're answering you, the way that they requested something, how they're just using their voice or just great brave talking, or if they're just with us and they're asking things or they're talking or sharing information, we always make sure to do a reflection or a specific phrase. So either repeating or paraphrasing what they're saying without kind of interrupting or asking questions, but to acknowledge that we've heard them or giving a label praise and or both. And I think you and I are very conditioned to that, but it's a really good practice to get into, especially outside the house. I think inside the house, these kids, we know most of them are extremely chatty. You aren't going to be praising every verbalization inside the house. But during the practice that we really encourage families to do, we want them to start to acknowledge when they're advocating for themselves, when they're really sharing information, when they're answering in full sentences, whatever it is, we want them to start noticing and acknowledging that more, since that they're not doing that everywhere. And I always feel like that's something parents always have questions about. They're like, why am I praising them when they speak to me all the time? And it's not about that they're speaking to you all the time. It's that we want them speaking all the time, everywhere. And that's not always the case outside the home.
Okay, we've got another question here,
Okay.
which is a very interesting one. So, this person's daughter is in third grade and has the same teacher that she's had since first grade. She's made huge leaps and bounds, will talk to peers, will talk to teammates, will order for herself, but still won't talk to her teachers or her coaches or her therapist. So, can you give us a little bit of insight into what might be going on for this child? Does the parent asks, does this still count as SM?
I love that question. So yes, it absolutely does. There's so many different presentations of SM. We've said this before that, if you've met one child with SM, you've met one child with SM. There are commonalities, but it's not consistent across them. So we have kids who will always speak to kids but not speak to adults. We have kids that'll have an easier time speaking to adults but never to kids. We have kids who don't speak to anyone outside their immediate family. There's a lot of different ways that these kids present, and some of them will make progress in some domains themselves, like socially motivated.
Mm-hmm.
Teachers tend to be the hardest, and
Oh, yeah.
just because I feel like they're evaluating, they're correcting, they have this sense of authority in the classroom. The demands are higher than they are anywhere else. And when you have SM in a class with a teacher, and that's kind of who you are in that class that year, and let's say you are making progress in other domains, and then you get that same teacher again, it's almost like that same role is still, you're still cast in that same role. And it's really hard to break through that. And I've seen this for years. I mean, my first intensive a million years ago, this girl's like now in her mid-20s. She, at her school, we went and did work there, and she made progress with the new teacher. And then she would see the previous teacher from 2 years before, and it was like all progress was gone. Like, it was just so hard. And it comes down to, is this important that you're speaking to this teacher from 2 years ago that you don't have anymore? Probably not. I mean, and it's always easier moving forward and going into new environments and going to meet new people. And this is why what our recommendations quite often are to experience new groups, do new drop-in classes and new activities, sometimes even new schools, for some cases, can be helpful. But old teachers, old environments are just more challenging. I mean, the word that's often used is contaminated, meaning their hardest moments were in that environment, and that person can be associated with that. It's not to say they can't ever get through it. It's just, it might be just trickier, and it might not be as easy as it would be if it was someone new. And it still counts as SM because there's a level of discomfort and your child not functioning in a way that they function normally inside their home when they're comfortable. So yes, I would absolutely count it as SM still. And I would still do the same thing that we always do in terms of working with them. And I would question how long she needs to be, or she or he needs to be in this environment.
Mm-hmm. Okay. So I think in the past, we've even talked about changing classes and depending on how flexible the school is to something like that, just providing that new class, that new environment, a new teacher. It's why we take such a large advantage of the beginning of the school year and run camps there and try and get in early with the teacher because it's so important to have that positive start to the year and kind of take advantage of that new environment when we do have the opportunity to have it.
So what was interesting about what you asked about, though, is that this child isn't speaking to a lot of adults, including their therapist, which makes me wonder where the therapist is in all this. Is the therapist doing training with the parents? Who's helping the child with exposures? It doesn't sound like there's a ton of progress that way. And some therapists, they might not be who the child is going to be talking with. And this is why we have treatments like PCITSM, where we're really empowering and training the parents to be the agents of change. The only thing that makes it a bit trickier is that the therapist isn't going to probably be as effective in the school environment if they go there to provide support.
Unless the therapist can train the teachers as well.
I mean, they can train the teachers, but sometimes with those teachers, they really need that bridge person to be there. And, we've seen it where we have an amazing rapport with the kids and we can get them pretty much to talk anywhere outside of school. And that's why we wait until we go into school. And then when we go into school, it's a little bit of a backstep from their normal functioning with us.
Yeah.
And we're able to work through it to get them to speak to the teacher. But if they're not speaking to the teacher, or to the therapist at all, the therapist going there might not be as effective right away. They just might not be ready.
Yeah. Yeah. Okay. One more question for today. How do you do exposures? I know it's a
It's
big
a big
one,
one.
and it's probably one that we'll address on many different episodes because it's a really important one, and it's kind of like the bread and butter of everything that we do in treatment.
Yep.
Um, but specifically, this person asks, "Do you say, would you like to wave to your teacher or your adult tomorrow,
Oh,
or tomorrow we're going to do this or that?"
I love that.
Do you ask the child what you're going to do for the exposure, or do you tell them this is what you're going to
Well, you know how I feel about asking. I feel like
do?
don't ask questions. You don't want if you don't want the
Yeah.
answer to them, don't ask the question. Again, I feel like there's steps to everything. And what we do therapeutically is we don't really ask what they want to do because it all feels hard. I think part of the trust is thinking that we're going to be doing little things consistently and increasing it as part of the exposures with the understanding that we're there to support them, but they're very planned out and they feel reasonable. They feel prepared for it. And we know that if they get stuck, we're able to prepare the situation a bit. We're able to really backstep and kind of help them practice again and then re-enter or adjust what the exposure is. But one of the things that I think when we were thinking about how we prepare families who don't have access to clinicians is how you start to lay the groundwork for it in terms of understanding what their self-talk is, really building the parent skills, even in terms of how to praise them or how to recognize behavior or how to set little goals and kind of start to operationalize what's coming ahead before we
And
ever
I
do an
think
exposure.
that's also in our journal why our month one kind of centers around the affirmation, "I am loved,"
Yep.
because we're trying to just just bring that support and the kids to feel supported while they're
Yep.
going to go through what is going to be progressively more challenging challenges that come up, particularly with exposures. So I think just to your point, we were really intentional when we were thinking about the structure of this and kind of guiding parents and children through exposures, because to make sure that the child feels supported and loved and that you're there alongside them is such a kind of foundation of all of the work that we do as well when we support the kids in going and doing exposures.
Yes, I think, again, the preparation for the parent mentally before they start bringing this up. I think the preparation of the child is really important. I think taking it in a stepwise fashion. We spent a lot of time thinking about how to convey this while making this a child-led activity. So the parent really is viewed more in the role of the support rather than I'm making you. And I think when we start asking those questions a bit too much, that's when the anxiety might override what the child feels like they want to do, as opposed to, this is what we're going to do. I'm going to be here to help. Here's what we mapped out. So more informational and with this belief that they can do it, but being really mindful of how hard is this and why is this so hard? And if it doesn't work the first time, what should we be aiming for? Should we be going at this in a bit of a slower manner? Have we worked really hard on them feeling confident and capable? Are there easier ones that we could do first to build up to the harder one? There's so many things we can do in between, and having someone face to face, I guess, I think is preferable for many, but hard to get access to. But there are ways for parents to do this. And I think we've really learned a lot about that when we've shifted the focus a lot to helping to train the parents, helping to answer those questions with also the sensitivity of they're going to give the parents a harder time than they do the therapists. And that's what's really hard too, is, you're this parent trying your best and it's hard. But when we get the parents feeling confident and capable, like they're armed with, okay, I can take if they're feeling resistant. If they're feeling emotional, like I know that this is something they're capable of. I believe in them. And how do I make sure my emotions are in check so I can convey that calm confidence to them so they feel like they can do it? And what do I do if it doesn't work? Checking again those emotions. How do I not feel irritated by it or disappointed? And work from a place where it's still positively stated and you weren't there yet. but I know you will be. It has such a different feel than
Wow.
being frustrated and like, we went over this or being critical. These kids don't need that kind of criticism. They also don't need the over enabling. I think that's the other piece of it too. We need them to feel like they have this and we know how they are when they're the most confident. I think that's what I always try to plant in parents' brains is you see your kid at their best. You even get to sometimes see them at their worst, a lot of times, but you also see them at their best. And that's what we're striving for. We're striving for them in their most confident, happy, free self. And when you keep that in mind and then you think about how they look when they're struggling, you know that we have a ways to go. So be thoughtful about what those challenges are and what makes the most sense. Going into school right away, not the best way to go about these challenges. It's just too big. It's like
It's too hard.
going
It's really
from, baby walks to like climbing a mountain. It's a lot.
I was just thinking about this question and this kind of giving them the choice and obviously how we feel about that. But also one of my favorite moments or favorite things that you do when we're going to do exposures is when you say to the kids, okay, I'm thinking of a number between 5 and 7. This is the number of people we're going to talk to. What's the number? And so they have that there is some kind of perceived choice there
Yeah.
for them, but you very much scaffolded what that choice is going to be. And I just love the way that you kind of throw that in there as well, because you're not asking the question, you're telling them this is what we're doing, but you're letting them feel like this, like they at least have kind of a say in how many people they're going to ask.
And the other part of why that even started, though, is a lot of these kids have trouble with guessing. And to randomly guess something you have no idea of knowing, whatever am I thinking of in my mind, is a really hard concept. And, a lot of times when they finally get there, like I'll have one or two guesses from other kids and they'll say the number I was thinking of. I'm like, exactly the number I was thinking of. It's such a nice way to praise them for that. And there's always the kid who, he's not feeling quite up to it yet. And they'll be like 0. I'm like, wasn't an option. Good trying though. Good telling us your first guess. So it's still reflecting, but
Yeah.
also helping them want to set those goals, and helping them guess and maybe not getting it because how would they know? Not only that, I'm not writing this number down. Like it could be any number technically, but I love it.
Really?
And when the kids are like, I want to do 20 and it's way above and beyond, I'm like, oh, we're in this great space where it's feeling easy, which
Yeah.
means we can up the challenges some more. They feel good. And that's
Yeah.
the best place to be when they're just like, piece of cake. Um,
Fabulous. No
yeah,
problem.
I know it's the best feeling when we finally get to that.
It really is. Okay, well, this has been our episode of Brave Talk for today. We've absolutely loved these questions that have come in. Please keep them coming in because they're so interesting and it really makes us feel that these are the things that you guys are struggling with and how we can help kind of plug that gap for you. And until next time.
Until next time, have a good one.
Bye.
Bye.